Hello, my name's Marianne Williams, and I'm a specialist gastroenterology community dietitian from Somerset Partnership NHS Foundation Trust. We set up webinars for patients around about 18 months ago, and we found there was almost no information out there on how to do it. So what we've done today is we've set up a series of 3 episodes to help you run webinars for your patients. The first episode, which I'm going to run through today, is why would you want to run a webinar for patients in the first place? The second episode will be about choosing a webinar company, somebody that will cover all the criteria you need for a webinar. And the third episode will be all the tips you need to set up your first webinar for patients. So let's start with episode 1 today, which is why run a webinar for patients in the first place. I want to introduce you to our webinar team here in Somerset. We're all dietitians, we're all HCPs. We've got Kerry Marchant, who is our IT specialist with the webinars. You've got myself, Marianne Williams. You've got Leah Seamark, who is our outcomes data guru. And you've got Leslie Harper, who's a very important member of the team as well. So what actually is a webinar? Well, a webinar is an educational, informative or instructional presentation that is made available online. Usually it's either a video or an audio with slides. So today you can see we're doing an audio with slides. What does the research say about using webinars? Well, in the last couple of years, there have been some good systematic reviews. And this one from 2017 said that virtual education was as or more effective than usual care in improving outcomes, including clinical indicators, knowledge, self-care, quality of life, and healthcare utilisation. The big issue, particularly in a county like Somerset, which is a vast county, is that with webinars, you do not need to travel. This makes it so much easier for the patient. They can be sitting at home in the comfort of their own sofa watching the webinar. They don't have to travel. And when we look again at one of the research articles, it said participants preferred to see a healthcare provider virtually rather than travel, with many indicating they would not have travelled to participate in a group session. And indeed, that's what we did find when we were doing our irritable bowel syndrome group sessions, is that many people would DNA at the last minute. I mean, it's a long way to travel and a lot of time that they had to take out of their day. So when you do a webinar, of course, you don't need to drive anywhere, therefore you don't need to pay for parking. And that might seem quite trivial, but for a lot of people, that's a huge consideration, particularly a lot of hospitals these days, the parking is phenomenally expensive. Really important is the fact that there's no need to take any time off work. You can watch this webinar whenever it suits you. I'm recording this webinar today on my own. There are no attendees listening, and I will then upload it as what we call an on-demand webinar. So you guys will be able to watch it whenever you want to watch it, whenever suits you best. So if somebody does shift work in the evenings, they might want to watch it in the morning. Other people might want to watch it in the evening after they put the kids to bed. You know, really, you can choose when suits you best. You can watch the webinar anywhere as long as you've got Wi-Fi or 4G access. And when we look at the research, the benefits of being able to take part in a group from home often outweigh the frustration of the IT problems. And that was from a systematic review this year in 2018. So it isn't that IT will put people off. If they really want to attend, they will get around those problems. You've no need to find care cover. So if you've got children, you don't need to find somebody to look after them so that you can attend appointments. If you've got elderly relatives living at home or a sick patient at home, you don't need to worry about finding care cover because you can watch that webinar whenever it suits you. And there's a greater feeling of anonymity. Now, this sounds like a strange reason for attending, but it's actually one of our highest reasons for people attending. And that's because a lot of people don't want to ask questions in front of a group. So the research shows that being at a home environment is less stressful than meeting people in person. And meeting virtually provides a greater feeling of anonymity and security and the ability to leave the group more easily if you want to. And that was from the systematic review this year as well. So the patient can choose a convenient time to watch, so whenever's most convenient to them. Is age a barrier? Well, contrary to some opinions, technology can be used in the care of older people who may have poorer digital literacy. And we know that as time goes on, technology is getting easier and easier to use. And so it's becoming less of a problem And in fact, if we look here at the age of our attendees, you can see here that the largest group of attendees is the 65 to 74-year-olds. Well, that really blows out of the water the concept that older people would not be able to take part in a webinar. And you can see neck and neck are the 55 to 60-year-olds and the 25 to 34-year-olds. So it definitely is not a facility that is only used by the young. You're able to re-watch a webinar to consolidate knowledge. Now that is so important. How many of us have left a consultation, you walk out the door, scratch your head and say, what did he say? I can't quite remember. Well, you can't go back in that door and ask him again. So with the webinars, you can replay sections of the webinar, you can replay the whole webinar, you can replay it as often as you need to make sure you've understood. And getting reliable information directly from NHS specialists is so important. It's our #1 reason for people attending. And that's probably a reflection of Dr. Google, the fact that people constantly go onto Google to look for advice. The advice is often conflicting, out of date, confusing. And the great thing is that people can sit down, watch this webinar, knowing that they're getting the most up-to-date thinking on a particular subject or condition from NHS specialists. So for instance, in our IBS webinars, we might just have specialist dietitians. In our celiac webinar, we had 2 gastroenterologists and a specialist dietitian. We're looking at running an inflammatory bowel disease webinar where we will have a GP and a gastroenterologist, a specialist nurse and a specialist dietitian, all as panelists. So you can see for those patients to sit down and listen to what that group of people has to say is really, really valuable. The effectiveness of virtual versus group sessions. Group sessions show similar outcomes to in-person groups. So this can make you feel comfortable that actually you're not giving a worse service by using a webinar. You're giving an equal service. And my feeling is that as time goes on, we'll realize it's actually a better service because of that ability to rewatch to consolidate knowledge. And people can participate in the webinar. So there are handouts that you put on the webinar and they can choose which handouts they want. You can put up to 5 handouts, and the handouts can be any size of PDF at all. So it could be a whole booklet is put up as one PDF. They take part in polls, which are a fantastic way of checking that people are understanding your webinar as you go along. So during the webinar, you might launch a poll, and if people get the answers wrong, it gives you a chance to re-go over that particular area and make sure that people have understood. And you can set a webinar so that patients can actually ask questions as well. So you can set the questions can come in with a live webinar there and then, and you can answer them as they come in. Or when you've got an on-demand webinar such as this, if the facility of the questions is turned on, then you can ask a question and a little pop-up box will come up saying, thank you for your question will be answered in, and you could put 24, 48 hours, 7 days, whatever suits you from a logistical point of view at work. So what about from the healthcare professional's perspective? How useful are webinars for them? Well, the good thing about webinars is virtually delivered approaches shift responsibility to the patients. They provide access and self-selection of the resources that you've put on there, and they can download the resources that they find most relevant and individually suited to them. You're really putting the responsibility back in their hands. They decide whether they're going to attend that webinar, when they're going to attend it, what resources they're going to download from it. It puts control back in their hands. And what about GP workload? Well, the way we've set up webinars in Somerset for our IBS patients certainly is that the GP does not need to do a referral letter. They simply need to give the patient our dedicated email address. Now, I'll go into more detail about the dedicated email address in episode 3, so please do listen to that if you want to know more. But basically, all they need to do, we have an email address that's patient.webinars@nhs.net. The GP simply needs to give the patient that email, no letter is needed, and then the patient will email us and we will send them the registration link. So we have no information about that patient, no medical background, no knowledge about them at all. They simply request the registration link and then they watch the webinar. We have surveys before and after the webinar, which I'll discuss in a minute. And so we will get feedback, but much more importantly, one of the downloads that we have for downloadable information sheets is a self-referral form. So if the patient feels that they need more help or more information, or they've done everything that we've asked them to do and it hasn't worked, they can fill in that self-referral form and come in for a one-to-one appointment. Now, a lot of people would think, oh, that'll open the floodgates. Actually, we've had 16 self-referral forms returned in the last 18 months. And I think that reflects the fact that if you give very good information, a lot of people no longer feel the need to come in and see somebody. So self-referral forms get round the fact that you know nothing about these patients, so they then choose if they need to come in for more detailed help. By giving them that facility of having access to webinars on specific subjects, particularly with our IBS patients, and I'm sure it's relevant for many other conditions as well, they no longer only have access to the GP to say, look, I need to go for an investigation. I'm not content with my abdominal pain. I think it might be cancer. Please refer me in for an investigation. Instead, now the GP can give them the webinar email address. They can attend the webinar, and if they're better, they don't need to go and see anybody. If they're not, they can at that point go back to the GP and discuss whether they're going for investigations. But you're basically helping to reduce the burden on secondary care by giving patients an easy option for education. No room hire logistics or costs. Finding a room to rent for your group sessions can be an absolute logistical nightmare. Making sure it's convenient for patients to access, that it's available at the right time that you need it, and then of course you've got the cost of hiring that room. Well, none of that is relevant anymore when you're running webinars. You can run a webinar from any venue as long as it's got Wi-Fi. We often run them from my office at home, purely because then we can guarantee that it'll be peace and quiet and we won't be disturbed. But you could run them from a hospital or a clinic as long as you've got peace and quiet and you're not going to be disturbed and you've got good Wi-Fi. Hundreds of patients can attend one webinar. If you're running it on demand, you can have hundreds of people watching that webinar, whereas if you run group sessions, you've got to keep repeating that group session over and over again, which means you've got to have the specialists who are running that group session there each time. This way, you only need to get everybody together once, you record the webinar, and that webinar is reused over and over again. We've had roughly 300 people now watching our webinars. So we've only run 3 sessions of webinars, and that's been watched by 300 people. So they really are very useful from that point of view. It's reduced our admin costs because all the administration to do with registering is done via our dedicated email address. So there's no letters having to come into the department, there's no administrative secretarial use. We basically manage all the emails coming in and send them the registration link. They can download all the information sheets they need direct from the webinar onto their computers. So there are no printing costs, no posting out of information, handouts, etc. costs. And the patient will just download what they need rather than being given a whole load of handouts at a group session, most of which they might not want or need. The data collection tools are internet-based as well, so you can use SurveyMonkey or Questback, and there are probably other services as well. So you're not having to post out questionnaires. You're not having to even email the questionnaires and hope they open email. You literally link the questionnaires to these online questionnaires to your webinar, and we get very good feedback. We get roughly about 90 to 100% filling in the pre-webinar survey and about 50% filling in the post-webinar survey. So you get some really, really good outcome data. And I go into more detail about the surveys in episode 3. So if we look at some of our data that we've got from our webinars that we've been running, so this is post-webinar data on our IBS webinars, and when we had about 111 posts, so that was about 50% of the people that filled it in. So we'd had over 200 attend. 50% of them had actually filled in the post-webinar questionnaire. And you can see that 78% felt that their knowledge and confidence in dealing with their IBS symptoms had improved or significantly improved. 80% of people found the webinar easy or very easy to use. So the largest cohort finding it very easy to use. So if you're worried about whether webinars are actually difficult to access for patients, that does not seem to be the case. And if you remember back to my age slide, actually our largest cohort is the 65 to 74-year-olds. Excuse me. So a lot of people are finding these webinars very easy to use. Would attendees recommend the webinars? Well, 96% of our attendees would recommend the webinars, or either likely or very likely to recommend them. And that may be a reflection of why we get very few self-referral forms in, because a lot of people feel that the webinar has been very helpful for them and that was all they needed. What factors were important to you attending a webinar? And I don't know if you remember, I said just now that access to reliable info is is by far the biggest and most important reason for people attending. Close behind that is the ability to rewatch. So we talked about consolidating knowledge, the fact that you come out of consultation and can't remember what anybody said. The fact that you can rewatch these is really important to people. No travel is next. And then you've got no time off work, anonymity. You see anonymity at 45 there. So really, really important about the anonymity. So lots of good reasons for why people want to attend a webinar. And now that you've watched the webinar, how would you rate your confidence in managing your IBS symptoms? Well, 78% of people said it improved or significantly improved. So that's a large number of people saying that they were much more confident in managing their IBS symptoms. We always put a couple of educational questions in there just to check that people really have taken on board and learnt from the webinar. And I'm just putting in one here. And this was a very simple one. Would allergy testing be useful in helping you find a solution for your IBS? Well, a lot of our patients think that allergy testing would be extremely helpful. So you can see that pre the webinar, 83% of people felt that it would be useful. After the webinar, when we'd educated them, that completely flipped around, and suddenly you've got 76% of people saying no, they would not be useful. And that shows a very clear indicator that people have learned from the webinar, have learned that no, allergy testing would not be useful, and that really shows it nicely. I think this, for any of you HCPs out there, or consultants, or doctors, anybody at all wanting to run a webinar, I think this is a really important slide. So this is our numbers of referrals to our dietetic-led gastroenterology one-to-one clinic between April 2016 and September 2018. So you can see that our average before the webinars was 30 referrals a month. We start the first pilot webinar in the July 2017, and we run our first proper webinar in September 2017. Since then, we've got an average of 16 referrals a month. Now that's nearly a 50% drop in our referral rate. That has meant that we can now take on inflammatory bowel disease in remission and celiac disease annual reviews. That would have been unthinkable beforehand, before we'd been using the webinars. So we have so hugely reduced our referral rate into our one-to-one clinics. We're now able to take on other conditions. So I leave you with this thought, really, that YouTube reaches 1 billion users every month and has transformed information giving in a little over a decade. I'm sure all of you listening have used YouTube at some point, if not very regularly. There is no reason why the NHS could not embrace webinar technology and transform patient-focused health education in the same way. So if you like the idea of the webinars, what should you do now? What I would suggest is that you watch episode 2, which is what webinar service should you use, and watch that webinar and see what information you gain from that, and then move on to episode 3 and how to set up your very first webinar. I hope you found it useful. Thank you for listening. Goodbye.